So I'm giving you an overview of where we have come in the year 2016-2017. That's up to last March. So in that time, we built significantly what we had done the year before. We collected the views of more than 4,000 Croydon residents and analysed these through our patient experience panel, which meets every 2 weeks, analyses the data, helps code it. We'll hear more about this later on. But it's a really crucial way of getting people involved in, not just in giving their views, but understanding some of the challenges and helping us produce reports. From those views, we published 6 reports, and we'll talk a little bit more about those in a moment. We did more than that. We completed 77 outreach events, so that's pretty much over one a week. And that included the South West London NHS grassroots campaign, so South West London Health, looking to get views on changes that are happening across South West London, asked us and gave us a grant of £10,000 that we had to go out and find groups that maybe we hadn't spoken to, and indeed many of the groups we spoke to we hadn't previously had a contact with, to get their views, to fund their sort of social events. And it was such a successful campaign that we've done the same again this year. More, I'm sure we'll hear more about that later. We also, so on our side we've got lots of views in and we produced lots of reports, but we also attended 140 health and social care related meetings, and that ranges from quite large scale meetings such as scrutiny, health and social care scrutiny at the council, which is, and the Health and Wellbeing Board, of which we are a member, and a statutory requirement to attend and contribute to. But we also had smaller meetings with various groups across Croydon and beyond, because we've also linked in with many other sort of wider advisory groups at Healthwatch England and CQC. So I wanted to really focus on, because the core of the work we've done in that last year were those 6 reports, and I just want to go over an overview. You should have all received a copy of our annual report which goes into more detail, but I just want to give you some highlights from each of those reports, because I think that this was the real core of the work we did in this year. First report we did was the anti-coagulation services. Now, we came across this one because we heard there was a change in service. Originally they'd been run by GPs and pharmacies, but this service got re-awarded specifically just to boots. And we were just interested in knowing, we'll change the service, how 3 months in, how things changed. What we found out was the service was actually good, 75% of the service was good. And that users were happy with this change, and it was a good model for shifting care away from GPs. But the crucial element is there's been a lack of consultation and communication by the CCG about it. When we published in 2016, the lead commissioner, Shafiq, welcomed the report and said the recommendations would help shape a future engagement programme. It was also presented at the Health and Wellbeing Board. So it's a reflection of the impact we can have in a small way, and just proving that the service works very well, but giving advice on maybe how it could be communicated better. We also looked at carers over 65s. Now, this is a big area in Croydon. Over 50,000 people in Croydon are over 65, 33,000 are carers, and we know that 35% registered with carer support. So working with the Carers Support Centre, Carers Information Service, we interviewed carers and found out that better communication was needed between health providers and carers concerning hospital discharge. More home support was needed, better care planning, and better promotion of the rights of carers. But again, it came very much down to communication processes and better information. When we published this report in August 2016, it was recognised by Croydon Council, and they said it would help inform the new integrated model of care, which of course is now the carer strategy, which I think has just come up and they've got further consultation with. And again, this was also presented at the Health and Wellbeing Board. So there shows an example of where we influenced new policy, which is now starting to take effect. Another big area for Croydon is mental health services. And in 2015, 67,000 people in Croydon had a mental health condition. That's 1 in 6 adults. It's costly to society and it's costly to the borough. And we heard from residents who were considered as carers and family members. What we heard from them was that there were waiting lists of 18 months for specialist psychological services. Many said they weren't involved in decisions about them and it wasn't aware of their care plan. Aftercare was limited. And some of those who were sectioned were sent 2 hours by car away from Croydon. Sometimes clinicians were too quick to reach for medication and patients, and particularly patients had some side effects. We recommended improving integration with lower waiting lists, better consultation and drafting when updating care plans, and giving opportunities for patients to be able to be more involved in their decision making. Both SLAM, that's South London, and Maudsley Mental Health Trust, and the CCG recognised the issues in the report and reflected their commitment to work together to address these issues, both with funding and commissioning services. And again, this was another report that was presented at the Health Wellbeing Board and discussed there. One of our largest reports in terms of numbers was our GP services. Here we got reviews of over 1,800 patients across Croydon, including every practice. And patients were broadly satisfied with the quality of service they received and understood the pressures of demand and waiting times. What they felt was that services were becoming less personal. There were difficulties in booking appointments by telephone, and that clinical judgments were being made by receptionists, and waiting for routine appointments with preferred doctors could be up to 2 or 3 weeks. We made some recommendations suggesting that maybe GPs could try to accommodate as many callers at peak times and trying to improve online alternatives to take the pressure off there. Maybe for triaging, that staff competency needed to be demonstrated and patients needed to be informed of delays. It's clear that patients understood the challenges that GPs were under, but again, it comes back to communication. When we published the report in September 2016, Dr. Agnello Fernandez, who is a local GP and at that time assistant chair CCG, now the chair, welcomed the report and said that he looked forward to working with Healthwatch to understand the issues more closely, which he did, because he came, as you may remember last year, for those who were here, to our AGM last year, which was dedicated to GP services, along with Commissioner Paul Young. And I think it's fair to say that was a very open meeting, a lot of views got expressed, and it was a really good example of all of us working together in a very positive way to look at some of these challenging issues. From a wider area and a wider group, we did a report with a small group, but a very important one, and this was refugees and asylum seekers, a group that's sometimes forgotten, especially in a borough of 380,000 people. Croydon has a higher than average number of refugees and asylum seekers due to a key home office building being in the borough. And we spoke to over 100 asylum seekers and found that they had real challenges in particularly in being accessed to psychiatrists. There were cultural challenges, as female asylum seekers would only want to see women GPs. And there was a sense that the community mental health team didn't visit hostels. And this is very interesting because as a result of this, we spoke and worked with the commissioners and again with SLAM, and we found out the reason why people weren't visiting hostels is that they weren't registered as GPs. They weren't registered with GPs, and to get referred to the system, you need to be registered with GPs. Again, this was a question of communication. No one was aware that you can register as a GP even if you don't have an address. So there was very much a campaign around that, to be raising that issue. We made some other recommendations around trying to share women, GPs, maybe more around different areas or areas of pressure points. It was very well received from the CCG, who took on the view of the report, and indeed I understand the promotional campaign telling homeless about where they can address about having a registered GP it came out as a result. Our final report was teenage sexual health services. Now, Croydon has a number of significant issues in sexual health for teenagers, with higher than average stats for teenage pregnancy, repeated abortions, diagnosis of sexually transmitted diseases, and that was according to the public health, according to the public health department figures. We spoke to service users at the point they use services on one-to-one interviews and found that accessibility, advertising and awareness of services with relevant help and delivery could be better. We recommended that teenagers are invited to give their views on services and help with design of sexual health services, and also explore some of the more maybe sort of psychological issues or feelings associated with seeking advice on what is, after all, a very intimate and delicate issue. We also felt that better advertising of services might be done with focused marketing towards those groups that don't seem to use it, such as teenage boys. This was recognised by Councillor Louisa Woodley, the Cabinet Member for Families, Health and Social Care, who supported the report's overall recommendation for continued engagement with service users. The Health and Wellbeing Board also supported this, with both Barbara Peacock, Head of People, and Rachel Flowers supporting the recommendation, and we've been working with Public Health to engage young people more in this important area. Beyond our report, we've also done a lot in trying to get our volunteers involved in not just in giving their views and in helping us in the crucial work they do in getting other people to give their views, but actually actively involved with groups. We have had Tarek here, who I think is here today, yes, who represented, who was on the Urgent Care Reorganisation Board. That was the board that decided the reallocation of services from minor injury units to GP units. And I only said last year when we spoke at the AGM how that was a incredible experience for him, because he learned much more about the challenges of how the system works and how you recommission services. We also had other volunteers who are regularly on group advisory groups for both maternity and mental health. And we shouldn't forget that grassroots has been really an important part of our year as well, because we've got this has helped us to get through, to focus our mind, should I say, on trying to get to those groups that we self-work with. And we had grassroots events with ASCII, the IDA Centre, Croydon People First, Croydon Youth Information and Counselling, Empowered Tamil Families, Drex Foundation, Lingua House, Mind in Croydon, My World Centre and Wellbeing You. Now I would say that 2 or 3 of those we knew before. There are a number that we didn't, and we've now built good relationships with them and have continued to try and go back to do more outreach or just keep in contact to get an understanding of their challenges and issues. We continued that this year with more, but I'm sure you'll hear more about that later. Final word, we are a small team, and what we've achieved this year could not be done without our volunteers, and there's a team of 70 volunteers that have been involved. Most of what I have said today could not have been done without them, so I'd like to finish by saying thank you to them for all their help, and it's been an exciting and very interesting year.